So once you have it, right, it is a long-term disease, okay? With intermittent painful arthritis, commonly at the big toes, foot, ankle, or knees. Okay, so this gout is a sudden pain in a joint which rapidly becomes swelling and hot, okay, and painful. So sometimes when this happens, you cannot move so much at the joints. You cannot move so much, means cannot walk. And then sometimes this affect not only one area, but also at other joints area as well. So in a later stage, it involves in multiple joints, including those with upper limbs, means your hands. So normally gout is at the lower leg, means at the knee area, your toes, but eventually it will come up to your hands as well. Okay, next one. What causes gout? Okay, so very importantly, right, actually gout occurs from high purine food. I will explain a bit later what is high purine food, but generally the cause of gout happen, okay, when there's uric acid produced in the body. Okay, so when you eat too much high purine food, food or drinks, it will cause to have a lot of uric acid in your body. So this uric acid is produced because when you eat a lot of purine food, your body break down, become uric acid. Okay, so gout is caused by uric acid, means a lot of uric acid form in your body. So that's how gout occurs. And the uric acid forms into crystals, normally built into the joint area. So if you see the photo here, right, you see the skeleton, that the joint got a yellow thing, that is where the crystals will form. So the chronic deposition means over a long time of this uric acid, this crystal can become into lumps. So I think maybe you have friends or family who had like the fingers or the leg, they got like a bit of things at the side. They call it tophi, okay? Invisible lump called tophi, okay? So the next is signs and symptoms of gout. Okay, so the signs and symptoms of gout. When gout happen, right, it occurs very suddenly. Suddenly, and then the pain is super painful, can reach between minutes to hours or few hours, can be 1, 2, 3 hours. Okay, so the joint normally involved in extremely painful when it's swollen, often swollen, warm, and red. And this development causes the joint to be painful. And then this is very easy to see whether is it a gout or any other arthritis. Because once that the joint area is painful, then we know, oh, okay, this is actually gout, not arthritis. And the common joints is affected at the first joint is a big toe. At the big toe, but it can also affect the knee area, your ankle, your foot, your hand, your wrist, your elbow. Okay, the shoulder and the hip joints in spine are rare. It's very rare, but it can happen. Okay, who does gout affect? Okay, so it actually indicated, right? Actually, majority of it is men, especially in their 30s. And then as they age, right, the risk increase. Number 2, actually less common in female. However, if they reach menopause, they have high likelihood of having gout. And gout often associated with other medical conditions like what? Kidney disease, wait kidney disease, blood pressure, obesity, and heart disease. Okay, so often patient, so sometimes this can also happen, right, when family members have got, means like, you know, your father, your mother, your uncle, your aunties, your grandfather they also have high chances of having gout. Okay, so having food that you eat food high rich of meat, seafood, alcohol also have higher risk of having gout. Okay. So who does gout affect? Sorry, again, this question. Question and answer. Okay. So I have a question for all of you. Why is it important to treat our gout? Let's ask. Anybody can answer. Why is it important? Why should we treat gout? Any takers?
Just because it's painful, so people have to treat it now. The patient.
Okay, good try. Thank you, Christina. Okay, so very important to treat gout because yes, pain is number 1. Number 2, gout can lead to deformity or immobility. Means it will cause certain, like, you know, your fingers, right, you have deformity, means got the profile, or it becomes immobility, means you cannot move. So without treatment, over the many years of gout attack can damage your joints, leading to deformities, pain, means consistently having pain, and eventually become immobile, means cannot move. Your functioning of your fingers, your leg, your toes cannot move. And persistently high level of uric acid can cause kidney stones and affect kidney function. That's the reason why we need to treat gout. Got it? So as we mentioned, why, right? Gout can easily manage with medication and lifestyle modification. Okay, so when a gout attack happens to a person, it can cause very pain. Okay, it's really painful that affects your moving, like your walking, affects even you want to go to work or you want to meet your friends, to drink coffee also will affect. And as well, it will affect your mood because when the pain occur, you will become very upset. Okay, so recurrent attacks may cause permanent damage to your joints, your tendon, and in addition, high uric acid level leads to kidney problem, kidney stones, and then increased risk of having heart disease, and of course, increase the death of cardiovascular death, means your heart lung. Okay, so then after sharing all this story, how do we treat gout then? Okay, so number one, right, beside looking at the symptoms, so as I mentioned, the symptom is what? Joint lah, pain lah, swelling lah, inflammation, right? You need to go to a doctor to do a clinical examination. Okay, measuring the blood level. So as you mentioned, remember the first part is when you take heart. Hello, I hear someone. Okay, so sorry, Florence, I mute you. Okay. Disrupted a bit. No. Where was that? Okay, so very important, right? Other than the symptoms that we mentioned, the swelling, the joints, the pain, we need to see a doctor because the doctor need to do a clinical examination to measure uric acid level. Remember, when we have the high uric acid level, then you have gout, right? So these are the levels that you will be confirmed that you have gout. So other than that, they will do a joint aspiration. So sometimes when they have tophi, like the joints, right, got lump, they will take some sample to check and test. Okay, to test whether there's any presence of the crystal, uric acid crystal, to confirm a diagnosis of gout. However, if let's say even with using that, right, they cannot what's it called? It's absence of the crystal, that doesn't mean you don't have gout. Okay, so most people with gout, they can have detection from different levels as well, different blood test level as well. Okay, so this is the next slide will be treatment. So treatment. So the treatment depends on what stage of the disease. Okay, so as I mentioned during the first slide, the gout is a chronic disease, means like it's long term. Okay, it's something long term. So if let's say now you're having a gout attack, gout acute attack, like now you're having an attack, the treatment plan is to provide pain relief, and of course the inflammation, shorten the duration of inflammation. And of course the goal is to ensure that this doesn't happen again in the future attacks. Okay, so again, the treatment is tailored to each person, different medication, different treatment plan. So the plan generally is to make sure the pain, the swelling is decreased, then to prevent the future episode again. Of course, if let's say they have lump, the tophi, they will try to treat the tophi or nodules accordingly. Okay, the next slide. Okay, so as you can see here, these are the common medication that is used during gout treatment. Remember, when the gout happens, it's always the pain and the swelling, right? So for the pain, you can see here, these are the medication for pain, to relieve the pain, like Kochi C, Kochi S, and SGH. Okay, then of course, to reduce the uric acid. Remember, I mentioned gout is because of uric acid too high, right? So these are the medication to reduce the uric acid. Okay, so it is important to know that not all medication are suitable for every patient. Not all medication that you see here is suitable for each and one of you. Okay, so the doctor need to look through for drug allergies factor or have kidney problems. Sometimes look through the kidney result, you cannot give certain medication. Okay, so it's very important to see a doctor to know, okay, doctor, what's the medication for me? Whatever is for me, you cannot be shared to other people or other colleagues. Okay, so very important, the goal is to reduce the uric acid level to prevent the attack. Okay. So remember when we talk about the risk factor, right? How you know how you get gout. So gout have other problems as well. Means, right? If let's say you have high blood pressure, you have diabetes, you have kidney disease, it can be correlation with gout as well. So you have high risk. Okay, so it's very important to screen for disease. So let's say you have diabetic lah, high blood pressure lah, kidney disease. So you must make sure you treat all these diseases first. Then it's easy for you to treat the gout. Yeah. So the uric acid crystal, okay, form a deposit in your kidney. So the very dangerous part, right, is where the uric acid is too high. This crystal, other than your joints, it will go to your kidney as well, your ureter, leading to having stones in the kidney. And then eventually can cause renal problem, kidney problem. Okay? So this slide very, very mouthful. So what you have to know on how to manage lah. Okay, so remember the first slide we talked about gout because of eating high purine food. Food that is high in purine causing the uric acid to go up, right? So very important, the food that you eat is the very important role of management of gout. Other than medication, other than exercising, the food, okay, the food lah, food on your leg, food to eat. So patient with gout should avoid this high purine food content. Very importantly also to drink water, lots of water, 2 liters per day. Okay, unless doctor say, hey, auntie, uncle cannot drink a lot of water. Unless doctor says so, then you please listen to your doctor. This one is for general. 2 liters per day is for everybody who doesn't have any issues. If your doctor tell you cannot drink so much, please listen to your doctor. Okay, patients should also reduce alcohol. So if let's say you're drinking alcohol, because alcohol also is not good lah for people with gout. Try to reduce it. And of course, if let's say your doctor say, hey, auntie, uncle, your weight is a bit, on the obese side. So try to reduce your weight as well. Then it will be easy for you to manage your gout and gout lah. Okay. And at the same time, if let's say you want to lose weight, right, you cannot like, I don't want to eat for 5 days. No, cannot have crash dieting lah, not advised. Okay. So lowering your acid level can help your diet lah. Okay. So number 1, food that's high in purine. Okay. In general, like asparagus, cauliflower, mushroom, oatmeal, and red meat, high purine. So try to avoid or minimal. Okay, meat extract. Okay, have high purine food as well. Meat extract means like broth, like you cook the meat, then you broth, the boil, right? The broth, the meat stocks, the gravies. Chicken asin, bak kut teh have high purine level. Okay, then certain fish like salmon, mackerel, prawns, anchovies, ikan bilis, sardine, cockles, mussels, scallops have higher levels of urine. Okay, then certain fruits like and vegetable like spinach, peas, strawberry, including strawberry jam, and durian also have higher purine level. Yeah, the next one, beans like peanut, bean cake, moon cake, nuts, right? High purine level. And of course, internal organs. We like to eat the internal liver lah, kidney lah, brain, inclusive of animal or birds have high purine level as well. Stress, huh? Okay, next I'll pass to my colleague. She will share with you more on what to do about gout. Okay.
Okay. So now you may want to ask, because my colleague already mentioned like everything, like a lot of things cannot eat, right? Now you may want to ask that if you have gout, so what else you can eat? Okay, so I'm going to share the things you can eat. Okay, so diet actually plays an important role in the management of gout. Patients with gout should avoid food with high purine content. It is also very important to drink lots of water, at least like 2 liters per day, unless your doctor tell you you are not allowed to drink so much. Also should reduce your consumption of alcohol and reduce weight. As my colleague already mentioned earlier, if you need to lose weight, you cannot lose so suddenly. If you lose too suddenly, your body purine level will go up also. So these are some gout-friendly diet available. Like food contain low level of purine makes for a gout-friendly diet. So the first one is protein. Although people with gout should avoid protein with very high purine content, such as organs, seafood, and shellfish, which we mentioned earlier on, and meats like venison, sausage, and bacon. They can still eat proteins with a lower purine content, moderate amount. And drink water also, at least like 8 glasses of water every day, unless you are advised to restrict your fluid intake due to medical reasons. Coffee and tea generally was okay for gout sufferers. And fruits, you can eat like fruits high in vitamin C, such as oranges, tangerines, papayas, cherries, apples, pears, pineapples, avocados. All these are low purine foods and therefore can be eaten in moderate amount. For vegetables, you can eat plenty of vegetables such as kailan, cabbage, squash, red bell pepper, beetroot, but limit the intake of vegetables with moderate purine content, such as asparagus, spinach, cauliflower, and mushrooms. For dairy products, all this milk, cheese, yogurt, all this is good for gout-friendly diet. Low-fat milk and low-fat yogurt also is excellent food for gout sufferers because they have low purine content, and so that they can lower the ability to lower the gout risk. Eggs are also low in purine, but do not eat too much. Health Promotion Board recommend to consume egg like 4 eggs per week. Cold water fish, essential fatty acids found in the cold water fish, such as tuna, which can reduce the gout inflammation. However, to prevent gout flare-up, to limit the intake of fish to 1 serving per day, because it also contains purine, but it don't eat too much, like once a day. Nuts and seeds. A gout-friendly diet also including like every day eat 2 tablespoons of nuts and seeds every day. It's a good source of low purine nuts and seeds, including walnuts, almonds, flax seeds, and cashew nuts. White bread, pastas, and noodles. All this is rich in carbohydrates are safe for eat for gout sufferers because they have a low purine content. But too much consumption of all these carbohydrates can cause a rapid rise in your blood sugar and increase the risk of developing diabetes. So on and off, you can eat some whole grain bread and whole grain pasta, which are healthier choice, but all this is contain moderate amount of purine. So you can eat occasional. So anyone can answer me, is there a cure for gout? Any volunteers? Anyone would like to answer? Is there a cure for gout? Sorry, Florence, I cannot hear you.
No.
No cure, huh?
I think you can just control the symptom by taking the medication. I doubt that there is a cure for it.
I think there's no cure. Once you get it, can avoid or so control, but cannot cure.
Cannot cure. Okay. Thank you for your answer. Let's see the answer. Yeah, there isn't a cure for gout, so you are right. Okay. However, all this can be managed with medication, diet, and exercise. You can control your symptoms. If you're able to control all this medication, your diet, and also do some simple exercise. Okay, so because gout is a long-term disease, so a combination of all this medication to control your uric acid level, which my colleague already mentioned earlier on. So there are 2 types of medications, anti-inflammatory medication drugs also when there's a acute gout flare-up. Lowering level of uric acid is the key to treating the gout because patient in the long term, if you do not use the uric acid lowering medication, the gout will reoccur again. We know that putting patient on uric acid lowering therapy early will help by lowering the gout risk. Lowering the uric acid in the blood to a certain level, chance of getting a gout attack is also reduced. Some medication reduce the formation of uric acid in the blood, while others can increase the uric acid excretion from the urine system. All this is aimed to reduce the uric acid.
Excuse me, by the way, what kind of exercise is useful?
Yes, which I'm going to tell you next. So you can do exercise, right? Can you exercise if you have gout? Okay, so these are some exercise you can do lah. So someone might ask like, should I walk or engage in any exercise when I have gout? Many people with gout will ask themselves this question lah, and the answer of course is yes, you can do exercise. But if there's an acute gout flare-up, of course you will stop. When in acute gout flare-up, even the pressure of a bed sheet can be extremely painful. Most patients feel better by elevating their feet and resting. Because most of the time the gout will affect the weight-bearing joints. That's why. Okay, so you can maintain a healthy weight, preventing the excessive weight-bearing force on your joints. Coincidentally, a healthy diet to control weight. Be careful not to lose weight too quickly, as this sudden weight loss can cause your uric acid level to go up. Exercise also helps control gout by lowering the uric acid level to prevent gout attacks. Researchers have found that fat in the body carries more uric acid than muscle. Thus, when you reduce your body fat, you can reduce uric acid level in your blood. Building cardiovascular health through exercise is also very important for people with gout because they have a higher risk of developing high blood pressure. Gout is also strongly associated with developing coronary artery disease. So gout is usually caused by build-up of high level of uric acid in the body, forms microscopic crystals. Uric acid is the normal metabolism waste product. These uric acid crystals can settle in your joints, often in your big toe and the middle joint, or where your toe connects to your foot. The build-up of uric acid crystals can also settle in your midfoot joint and your ankles, creating more severe pain, and also sharp. Maybe visibly also swollen, may look red and feel warm to touch. These low extremity joints are weight-bearing joints. So movement such as walking is very, very painful when someone in the gout flare. A typical gout flare can last up to 2 weeks. Because although it can start to feel better quickly when treated with anti-inflammation medication. When you are in the midst of gout flare, to reduce weight on your feet and other weight-bearing joints by using the walking aids, such as like walking stick, walking frame, or this you can hold in the hand opposite your affected foot in order to unload the joint. So let's say the gout affect your left side, so you can hold the walking stick on your right hand, the more stronger side. Unloading the joint relieves the force put on your joint, which can reduce the inflammation and allow you to move and for your daily activities. You can also put ice or cold water to reduce the inflammation and relieve pain, reduce the swelling also. But this should be based on your personal tolerance because some patients, they may feel very sensitive to the temperature. Anti-inflammatory drugs, earlier my colleague already mentioned like anti-inflammation drugs, colchicine, glucocorticoid. Sometimes doctor will order this to help with the acute gout flare. Yeah, some medication like allopurinol are also used to keep the uric acid level low and to prevent future gout flare. So these are some examples of exercise after a gout flare. You can do aquatic water exercise, which may be a good way to start engaging in exercise because the buoyancy of the water will reduce the impact on the joints. Low impact aerobic exercise can be helpful too, such as the elliptical machine. It's important to keep your joint flexible by incorporating stretching and range of motion exercise. Once the gout flare subsides, promote good joint movement. Be careful not to overdo it and overexert yourself. So you do it within your limit. You should not be experiencing pain when walking once the flare has subsided. If you do experience pain with walking after gout flare, go back to use the walking aids to support you when doing exercise and reduce your planned exercise until the pain subsides. So these are important tips when doing exercise. So first one is to choose the right footwear because gout often affects the big toe, the midfoot, the ankle, and choosing good footwear is very important. Physical therapists can help evaluate the best footwear for you with gout based on evidence shows Specialized footwear provide benefit for patients by changing alignment of the leg and foot, influencing activity of muscle of the foot and your gait pattern, like the way you walk. These modifications are designed to decrease the pressure on your joints. Also follow the comfortable walking pace, so don't walk too slow, don't walk too fast, follow your own pace. Your goal is to move without pain, so start slowly, using walking pace that creates the least amount of stress and pressure. When you feel more comfortable with the walking stride, then test gradually faster pace. So you slowly increase the pace suitable for you. Include other low-impact aerobic exercise. Beyond walking, consider adding different heart-calming activities into your regular aerobic exercise, such as swimming or riding a stationary bike. Both of these are especially good options for gout patients because they don't put as much pressure on the weight-bearing joints of the feet, ankles, and knees. An elliptical machine can be a smart choice to get your arms and legs moving without excessive joint force. Stretch your affected joint. Once your gout flare subsides, you want to regain flexibility in the joint to ensure easy movement. Do simple stretching by slowly moving your joint forward, back, then around a comfortable limit. Repeat 5 times and gradually increase repetitions. Build muscle with strength exercise. Having strong muscle can protect your joint from wear and tear, especially for joints affected by gout. Beyond weight training, simple resistance exercise, use your own body weight can be effective also to build muscles. For example, try the elastic resistance band. So you're holding each other, holding into each hand, then putting your foot in the middle. So you just stretch. This one can increase the flexibility. Repeat, But the key with any exercise after gout flare is to go slow and listen to your body. But before you do all this exercise, please consult your doctor before doing all the exercise. See whether you are suitable to do exercise or not. Okay, so this is all about our health talk for gout. Please join us for the next health talk. We will have a Chinese session next Monday. Yeah.
Any questions?
Yeah, any questions for us?
Hi, sorry, because I joined late. The first 2-3 slides, can you just flash any for me to have a look?
Yeah, sure.
Thank you. Not so fast. At least give me a minute or two. I may want to take some pictures, please.
Oh, okay. This is all our content.
Okay, second picture, please. Okay, third picture.
Sorry.
Okay, fourth one.
Sorry, very nice. We'll be doing a recording, right?
No, I just take from here. Okay. Okay, signs and symptoms. Okay, already.
Can
One moment. Okay.
the rest any questions?
I want to ask, is it gout only affect the big toes? Only the toes only?
As we mentioned in the slides, okay, eventually it will go to other parts of the joints. Okay, wherever got joints, your knees, your fingers, elbow, wherever part there's joints.
Oh, then what about the finger? They don't they call it arthritis?
So the differentiation between arthritis and gout has pain, painful area, means it's very painful, swollen and inflamed. That's the differences with arthritis. Arthritis is just a pain sensation, but it doesn't get swollen, it doesn't get really painful.
No, it gets swollen. It gets
the
swollen for arthritis on the finger.
But is it very painful that lasts you
Painful.
for hours?
Yeah, it's painful.
The differences between gout and arthritis is swollen and it's painful. It's very different kind of pain. So to know whether you have arthritis or gout, you can see a doctor. First, doctor need to do clinical examination.
Okay, thanks.
Thank you, Tina and Jun Fang. I think we have 2 questions on the chat box. So the first question It says that doctors say that they usually won't dispense the medicine unless they have external symptoms. So for such cases, if there's actually external symptoms, then medicine will be given. Will it be too late?
Okay, so there must be a reason why doctor did not give you medication. So as a doctor, so number one, right, you need to ask whether have the doctor diagnosed, and if it's diagnosed, and whether you're on medication. So if let's say you're not on medication, right, so you need to ask the doctor lah, whether, because sometimes there be renal impairment, there's multiple factors for doctor not to give you medication. It can be your kidneys not doing well. So you need to ask the doctor, you know, when you're going to start the medication for me, and if you have to look through your symptoms. So if let's say your symptoms have been increased, do write it down, and your next doctor visit, just inform the doctor, look, I have this symptom, so and so, my pain has been intensified, normally it's within 5 minutes, now it's like 10 minutes and so. So you need to tell the doctor. Okay, question from Mount Faber. What is a cold water fish? Okay, see the slide. So the next question, high uric acid reading, also doctor will give meds. You need to talk to the doctor and ask what is the high level, because there's a range for doctor to give a medicine. So normally when doctor want to give any medication, they will weigh the risks, the pros and cons. And do go back to your doctor and ask. I think it's a previous slide.
So sorry, the test is blood test that can tell whether you
Clinical examination, blood test, but even if the blood test, it doesn't show, there's other blood tests to check, and of course the next month, you'll do an exploration on your joint. So if let's say your gout has become so severe that there's a crystallized deposit, right, you'll aspirate from your joints.
jab.
Aspirate, inject, so they inject and then they withdraw the fluid. So that's gout. So if let's say you have chronic disease, meaning that you have diabetic hypertension, you need to control that part.
Have, but like, you know, like somebody may have kind of we call that what, banyan, yeah? Banyan can be also mistaken. Banyan at the foot can be mistaken as gout.
Sorry, banyan.
Banyan. That means the toe, the big toe of the foot like jerk out. Right? Then sometimes can be painful.
I don't really understand that banyan word.
I think she means banyan.
Bunyan.
Banyan and gout is two
Not as
different.
banyan or bunyan, I don't know. B-U-N-Y-A-N.
That one is two different issues. It's not the same thing.
But not being mistaken to be
So normally, right, in order for doctor to diagnose you as gout, there's a lot of clinical examination to check So that's why very important. You all don't self-diagnose like this yourself. Hey, I got gout, I got this, like that. No, you have to go to see a doctor, medical professional to see whether do I have this or not. Yeah.
Hello, Tina.
Can you,
From Mount Faber. Is our question answered?
coming to you now. Can you answer now?
Thank you.
Yeah. I saw the question they are asking, like, what is cold water fish? So this cold water fish is actually means those species of fish that are in the very cold water. They live in very cold water, but not limited to salmon or salmonid. May also include all these they got different type of species of fish. But here we recommend to eat tuna for cold water fish for gout patients, because tuna got low purine contents compared to other cold water fish. Does that answer your question?
Any more questions?
Sorry, what do you mean? Tuna is safe or not safe to take?
Tuna is safe for patient with gout, generally speaking. But also
Oh.
depends, but don't eat too much also because
Yeah,
all the fish also contain purine content. Just that tuna has a lower purine content compared to other fish.
So must consume in moderation now.
Moderation, once a day, only once. Okay, do not eat too much.
Very important. If let's say you have gout, okay, and you want to know specific diet, what to eat, please go to see a doctor, and the doctor will refer to a dietitian. Remember, everybody is different. Everybody body type is different. Blood size, test level also different. So there will be, if let's say you want to know individually how many amounts of this and that, right? You have to go to a doctor. Doctor will tell you. The dietitian will tell you specifically for you, for me, Sri Latina, for myself, like that. Okay, if you want to know specifically. So whatever we share is a general. General means overall is the do and do. Yeah. Any more questions?
So can I add on to something? When you mentioned about the cold water fish, right? And you also mentioned about salmon. This sort of fish have more purine. So what about other types of fish that are not mentioned? I suppose they should be safer, right? For example, we have in Singapore, like the mackerel, the horse mackerel, you know that type, the threadfin.
So if you see the slide here, so if you see the slide here, in general, right, food has high purine is what? Salmon.
Yeah lah.
Mackerel. So they have higher purine. So in general term, whether what are you? So you're asking what is the food or fish that is safe, right? I cannot say which is safe and not safe. Okay, because in general, you're only advising people with gout to just be aware because this type of food have higher level of purine. Higher level of purine has produced uric acid, which cause you to have gout and cause you to have relapse. So our role here is to educate you guys, to tell you, hey, look, this is A. Try to avoid, minimize, control, because this group of food can cause you to have relapse of gout or etc. Okay, whether which one is safe, not safe, which fish, the one you can't really say much lah. Okay, that be okay?
Vegetable like broccoli. What about vegetables like broccoli? I ever heard, but here not mentioned. The
high purine level. For now, we are only sharing spinach, peas.
Yeah. So broccoli, okay.
Broccoli for what? Gout? For
Ah,
what? Broccoli for?
it's safe to take broccoli, not the veggie.
So to avoid gout, right, is to prevent to cauliflower. Broccoli for gout, is it?
Yeah.
If you have gout, please seek your doctor.
No, don't have. But I just take for reference. Because I think like broccoli high in calcium, right?
Yeah. We're talking about high purine as a high purine level food.
So broccoli is not high in purine.
Not indicated here, but again, please, if let's say you want to educate your friends, your family, if they have gout, please ask them to see a doctor, okay?
Okay.
Very be careful when we share things to people. We must ensure that the person, because we don't know what the patient has, your friends and a relative might have other things like kidney problem, then you have to avoid a certain food as well. So this information is for you to know. If let's say your friends know, you can tell them generally, but in details, we don't know whether they have heart problem. Some patient heart problem cannot take green leafy vegetable. So it's very hard for me to say yes or no. You need to see a doctor. Okay? Any other questions? Okay. So it's no more question already, Okay, so for next week will be in Chinese Mandarin lah. So you can join in. I mean, since you guys are here with the other groups lah. Okay, thank you. Nothing next.
Thank you.
Thank you.
Okay, thank you. Guan, will you be showing them the QR code for the patient scan? Okay. So for those who would like to earn your passion card points, for now you can actually take out your phone camera and scan the QR code to actually accumulate the points for your passion card. Okay, so once again, thank you Tina and Jun Fang for your sharing. So for those who would like to join us for next week in the Mandarin version, do join us again at 2 p.m. next Monday, which is 28th of November. I have also shared the link itself on to find out more for our upcoming health talk as well. You can also sign up accordingly via this web link that I shared on the chat box. Okay, if there's no further question, I think they will leave this QR code for a short while, and then we will see you next week. Thank you.
No, next week, same topic, but in Mandarin, is it?
Yes, that's right.
Thank you.
So next week
Thank
will
you,
be in
nurse.
Mandarin.
Bye-bye.
Welcome. Bye bye.
Please mind the platform gap.